Welcome back to our course on research for evidence-based social work practice. For this week, we are going to talk about another topic. I hope everyone had a great reading week. Before we dive into this week's topic, a quick reminder to complete the midterm evaluation on Quakers. Your feedback is valuable for enhancing this course, especially for the asynchronous section. So rest assured, it's completely anonymous. Well, today we will explore crucial concepts in determining the effectiveness of social work interventions, focusing on effect size, number needed to treat, NNT, and statistical power. These concepts are fundamental in assessing the impact and practical significance of research findings in our field. In evidence-based practice, understanding the effectiveness of interventions is important. Effectiveness is measured through various statistical means, including effect size, which quantifies the strength of intervention's impact, and NNT, which tells us how many clients need to be treated for one to benefit significantly. We will also discuss the importance of statistical power in designing studies that can genuinely detect meaningful effects. So please pause this lecture video and click this link to see the lecture number needed to treat as a background knowledge. Recall what we have learned from last week's statistic. You know, while a p-value less than 0.05 may indicate statistical significance, it does not necessarily mean the intervention has practical or clinical significance. We must consider the effect size and NNT to gauge the real-world impact of our interventions, especially since p-values can be influenced by the sample size of our studies. Effect size is a standardized measure that allows us to understand the magnitude of differences or association across studies. For example, a small effect size might indicate a slight improvement in client's outcome due to an intervention, while a large effect size suggests a substantial improvement. Understanding this metric helps us critically evaluate the efficacy of social work practice. Interpreting effect size involves comparing it against benchmarks for small, medium, and large effects, depending on the statistical test used. This comparison helps us assess the practical significance of study findings beyond the mere statistical significance. Let's take t-test on means, for example. You can see on this table, t-test on means compares the averages between two groups. We use Cohen's d as the effect size index. A d value of 0.2 indicates a small effect. 0.5 is a medium effect, and 0.8 is a large effect. This is all default, so you can just remember or take this table as reference. Imagine a study assessing the impact of a new educational program on students' performance. A d-value of 0.2 might suggest that while the program has an effect, it is relatively modest. Absolute risk reduction shows the difference in improvement rates between the treatment and control groups. These metrics are valuable in decision-making and policy formulation in social work. Let's break down with an example. Consider a clinical trial evaluating a new drug intended to improve patient outcomes for a specific condition. The results can be dichotomous. meaning the outcome is either yes, the treatment worked, or no, it did not work. To calculate ARR, we compare the success rates between the treatment group and the control group. The experimental event rate, or EER, reflects the success proportion within the group receiving the active treatment. Suppose we have 25 patients in this group, and 20 shows improvement. Our EER is 80%, represented as 0.8. On the other hand, the control event rate, or the CER, pertains to the group receiving a placebo or a standard treatment. If in the same study, 10 out of 25 control patients shows improvement, our ECR is 40%, or 0.4. ARR is the difference between these two rates. In our scenario, the ARR is 0.8 minus 0.4, giving us an ARR of 0.4 or 40%. This number represents the additional benefit provided by the new treatment over the placebo. In essence, an ARR of 40% means the new treatment has led to a 40% increase in the rate of improvement compared to the control. This is a significant figure for the healthcare providers, as it helps to quantify the actual impact of an intervention on patients' outcome. The number needed to treat NNT represent how many patients needed to treat to achieve one additional favorable outcome, or conversely, to prevent one adverse event. It is a crucial measure for it to translate the effect of an intervention into practical terms, indicating its efficacy. To calculate the NNT, we take the inverse of the absolute risk reduction, ARR, which we discussed previously. Recall the ARR from our last example, where the treatment led to a 40% improvement over the control. We calculate the NNT by dividing 1 by the ARR, which in this case gives us 1 divided by 0.4, resulting in an NNT of 2.5. Now we cannot treat half a patient, so we round up to the nearest whole number. Therefore, we would need to treat 3 patients to ensure that 1 patient benefits from the intervention. This number is pivotal for healthcare professionals and policymakers, as it provides a direct understanding of the treatment's effectiveness. For example, in a hypertension management program, if the NNT is 3, it means that treating 3 patients with the new drug will result in 1 additional patient achieving the target blood pressure range compared to the standard treatment. So as we advance in our course, knowing the concept of NNT will empower us to critically evaluate interventions and their practical applicability in clinical settings. And you may also discuss this in your final paper. So next class, we will talk about systematical reviews and meta-analysis.